Almond milk is often promoted as a healthy alternative to dairy milk, but you may have heard that it can cause kidney stones. So should you stop drinking it? The truthful answer is not necessarily. Almond milk may be relevant for some people, particularly those prone to calcium oxalate stones, but it is not the whole story. Almond milk may contribute to kidney stone risk, but it is not a universal cause. Kidney stones are rarely caused by one food alone. Your risk depends on the type of stone, urinary oxalate, hydration, calcium and sodium intake, genetics, gut absorption, and how much almond milk you consume. Before changing your diet, it is important to identify the type of kidney stone. Almond milk is mainly relevant to calcium oxalate stones because almonds contain oxalate. Calcium phosphate, uric acid, struvite and cysteine stones develop for different reasons. This is why I do not recommend a strict low oxalate diet simply because someone has experienced a kidney stone. Oxalate is a natural compound found in many plant foods. Some oxalate is absorbed through the intestine and later excreted in the urine. In susceptible people, higher urinary oxalate can combine with calcium and contribute to calcium oxalate crystal formation. However, oxalate absorption can vary significantly between individuals. In one laboratory comparison of popular plant-based milks, the almond milk tested had the highest oxalate level. Cashew, hazelnut, and soy products also contained more oxalate than several other alternatives. However, this study compared individual products. It did not prove that every almond milk brand, or every serving, causes kidney stones. It shows a potential risk that should be considered within the person's complete clinical picture. The practical question is not simply, do you drink almond milk? We also need to ask, how much do you drink? How frequently do you drink it? And how concentrated is the product? An occasional glass is not the same as drinking large quantities every day. Homemade almond milk may also contain considerably more almonds per cup than some diluted commercial products. The dose and frequency influence your total oxalate exposure. Many people hear calcium oxalate stone and immediately reduce calcium. However, consuming too little dietary calcium may actually increase oxalate absorption. When calcium and oxalate are consumed together, they can bind inside the digestive tract. This means less oxalate may be absorbed and reach the urine. For most calcium stone formers, maintaining normal food-based calcium and consuming it with meals may be more appropriate than following a low-calcium diet. I would be more cautious about almond milk if a person has recurrent calcium oxalate stones, high oxalate on a 24-hour urine test, fat malabsorption, certain bowel conditions, a history of bariatric surgery, or very high daily almond consumption. These people may benefit from choosing a lower oxalate milk alternative. From my naturopathic perspective, the word almond is not enough information. Commercial products vary considerably. Look at the base ingredients: calcium fortification, added sugar and sodium. If chronic kidney disease is also present, potassium and phosphate additives may require additional consideration. Recommendations should be based on the actual product and the individual's overall health, not only the marketing claims on the front of the carton. Shop-bought almond milk is convenient, but it is not always my first choice. Depending on the brand, it may contain added sugar, flavors, oils, gums, emulsifiers, or stabilizers. These ingredients may be used to improve the taste and texture or to reduce natural separation. However, it is important to be accurate. Not every carton contains chemical preservatives. Heat treatment and aseptic packaging can also extend shelf life. Read the ingredient list and choose the simplest, unsweetened product you can find. Calcium fortification can be helpful, so a longer ingredient list does not automatically mean that the product is unhealthy. Homemade almond milk is easy to prepare. You do not need to be a chef. Soak 1 cup of raw almonds in water for 8 to 12 hours. Drain and rinse the almonds. Place them in a blender with 4 cups of fresh water and blend until smooth. Strain the mixture through a nut milk bag or a fine clean cloth. Transfer it to a clean sealed glass container and refrigerate. Natural separation is normal, so shake it before serving. You can optionally add some vanilla, cinnamon, or a small pinch of salt. I do not recommend adding sugar. Use it promptly and discard it if its smell, taste, or appearance changes. However, there is an important caution. Homemade almond milk is normally not fortified with calcium. It may also contain more almonds per cup, and therefore more oxalate, than a diluted commercial product. If you have recurrent calcium oxalate stones or high urinary oxalate, homemade almond milk is not automatically the safer choice. In one laboratory comparison, coconut and flax milk had undetectable oxalate, while oat, rice, and macadamia milk were relatively low. However, lower oxalate does not automatically mean that a product is nutritionally equivalent to dairy milk. Choose an unsweetened product and consider its calcium fortification, protein content, ingredients, and place within your total diet. My naturopathic approach is not to remove almond milk automatically. First, identify the kidney stone composition whenever possible. Next, complete a 24-hour urine test to assess urine volume, oxalate, calcium, citrate, sodium, and pH. I also review hydration, sodium intake, bowel health, fat absorption, previous gastrointestinal surgery, food choices, and supplements. The objective is to identify and address the underlying mechanism, not blame one isolated food. The most important general prevention strategy is adequate hydration. The objective is to keep the urine diluted, although fluid requirements vary according to climate, activity level, and medical conditions. Maintain appropriate food-based calcium with meals, reduce excessive sodium, eat a variety of fruits and vegetables, and review unnecessary high-dose vitamin C supplements. Lemon water may provide some citrate, but it should not be presented as a magical kidney stone cure. If you have never experienced a kidney stone, do not have high urinary oxalate or a malabsorption condition, and consume almond milk moderately, there is no strong evidence that you must avoid it. Hydration, dietary variety, appropriate calcium intake, and your overall dietary pattern may be more important than one beverage. The truth is not that almond milk always causes kidney stones. The truth is that it may become a meaningful source of oxalate for a susceptible person, particularly someone with recurrent calcium oxalate stones or high urinary oxalate. Know your stone, test your urine, then personalize your diet and choose your milk accordingly. If you prefer homemade almond milk, keep the ingredients simple and the portion moderate. Do you drink almond milk? Tell me why in the comments. For more practical health education, explore my Heal Your Body Naturally course through the link in the description.